Medical clearance for cannabis. Procedure for official licenses for use of cannabis laws, whereby you can catch diseases labeled as suitable for the treatment of medical cannabis. Is everyone allowed to get permission to use medical marijuana? Unfortunately, not only patients who are on the list of approved indications for treatment are entitled to medical marijuana laws, and moreover, that only patients who have exhausted or have developed resistance to all other treatment according to evidence the specialist healthcare providers. Who can get medical cannabis authorization for oncology? Patients during chemotherapy and up to 6 months from the end of treatment to ease nausea, vomiting or pain associated with the treatment. Even without exhausting other treatments to relieve symptoms, conventional chemotherapy. In cases where the physician believes that cannabis should continue treatment later half of the year. To relieve pain from a metastatic stage cancer and treatment options extraction accepted. Who can get medical cannabis authorization in the field of gastroenterology? Patients with active inflammatory bowel disease and proven, for example, Crohn's disease or vasculitis and meet the criteria at 1. Have been exhausted and have failed conventional medical treatments of at least immunomodulatory herbs such as 1, for example, Aimran or Forintil for at least 2 months and the addition of at least 1 TNF example, Humira or Remicade loading dose control, E2 treatments. 2. Revocation of surgical treatment option of removing short section of intestine ill. Who can get medical cannabis authorization in the field of pain? Patients with neuropathic pain of organic origin is clear, familiar pain clinic patients during a period of at least 1 year before the filing of the application, after exhausting conventional treatment options and recommendation of the pain clinic where they are treated. Who can get medical cannabis authorization in the field of infectious diseases? Patients diagnosed with acquired immune deficiency such as AIDS and regardless of CD4 level, after exhausting accepted medication, which suffer from the extreme weight, more than 10% loss of body weight, to improve appetite or to facilitate vomiting and gastrointestinal symptoms. Who can get medical cannabis authorization in the field of neurological diseases? Patients diagnosed with multiple sclerosis in situations STIM who did not respond to the usual treatments. Patients diagnosed with Parkinson's disease treated for at least 1 year anti-Franconi therapy, chronic pain or pain caused by Brigida. Adult patients diagnosed with Tourette's syndrome, suffering from significant functional daily lives. Conventional treatments have not responded. Adult patients with epilepsy, and meet the criteria at 1. Diagnosed with epilepsy is difficult for at least 2 years and have dysfunctioned significantly. The exact definition according to the procedure of seizures of this type are seizures causes of disability, including seizures clonium generalized seizures type partial complex seizures tones or atonium rules and partial seizures. Others may cause a risk of falling and sabotage. 2. In a situation where resistant epilepsy after failure of at least 5 antiepileptic drugs listed as monotherapy or as combining drugs. 3. Epilepsy is characterized by seizures frequency of at least 1 seizure a month in medication documented. 4. Patients minors, under 18, with epilepsy is difficult uncontrollable, after the development of resistance or failure of at least 1 conventional treatments 5 medications, treatments sample ketogenic diet, vagus nerve stimulation or surgery. Who can get medical cannabis authorization in the field of palliative diseases? Terminally ill patients who define their life expectancy does not exceed 6 months. Who can get medical cannabis authorization field of psychiatric illnesses? Adult patients diagnosed BTR traumatic stress disorder and meet the criteria at 1. Post-traumatic stress disorder with mild or higher and meets the criteria of 21% disability. At least by sections of the NSC, which extends beyond the 2-year period and is characterized by great emotional distress. 2. When exhausted at least 3 pharmacological interventions, acceptable minimum periods of at least 2 intervention and 3 were incorporated, and exhausted conventional psychological interventions. Procedures for issuing license for medical cannabis. The request for authorization to use medical marijuana should be served by a specialist practitioner attending over the time period defined procedures. Procedure 106, however, not all patients with the disease are entitled to receive approval for the treatment of medical cannabis, and therefore, it is important to review the specific procedures outlined for each disease. The request cannot be served by any other doctor who specializes in disease of the patient, and also important to note that family doctors reject requests outright. Sharpen again at the physician submitting the application to become a doctor versed in history that the treatment of the patient and competent to engage in specific illness. Shortening the process of issuing licenses for cancer patients. It seems that with time, Israel is moving toward legalization. However, Israel still only some 30 doctors who heads issue licenses for the treatment of medical cannabis patients themselves. It seems that the way for a long medical certificate, and not all patients get benefit from this shortcut, but only in cancer patients are entitled to receive the services of these doctors. These doctors are employed by the Ministry of Health and are required to work in accordance with the procedures of the issue, but they are allowed to issue their own license hospitalized at the hospital where the patient, regardless of medical cannabis unit, ICAR. The advantage is time. The issuance date is between 24 and 48 hours from the date of application. How to apply for medical cannabis. The doctor to accompany the patient throughout all attempts therapeutic, to recognize the history of treatments and understand the nature of the patient's response to any drug, not quite that submitted the request, in order to bring success maximum and obtain a permit for the patient to make homework. Arrive with medical file including the full prescribing medications taken during the year or the last 2 years and every so forth. The request should include documents at 1. The details of the patient's medical history. 2. The details of the treatment history of the patient, which treatments were given, the results and the patient's condition after these treatments. 3. Providing a detailed reason why it was necessary for medical cannabis patient care, including an explanation will improve the situation. 4. Score character marijuana treatment, the use of oil or flowers, and specifying the name of one of the company's cannabis in Israel if there is a personal preference that. 5. If the disease does not appear in the list of the approved indications, the doctor attached to the applying scientific information and scientific studies proving that medical cannabis therapy helps and the advantage of this particular disease patients. Where to send the application? You can download the application form at the following URL. Click here. The form with the medical records and the specific information required to be sent to a fax number 026474810 can confirm the arrival of a dedicated fax telephone 086268000. Yeah, well, you can send in a copy of the documents in honor of the Ministry of Health, the only medical cannabis, ICAR, 39 Jeremiah Street, P.O. Box 1176 Jerusalem, zip code 9101002. Or email imca@ma.health.gov.tl. When we receive a formal reply. After submitting there, all that remains is to wait. Waiting time ranges from 2 weeks to 2 months to receive an official response from the Ministry of Health.